Lung cancer diagnosis is never easy. I'm joined here today with Dr. Robert McGead, who is a thoracic surgeon at CU Medicine. Today, we are discussing lung cancer surgery, what it involves, what patients can expect before, the day of, during surgery, and recovery. Dr. McGead, can you walk us through what happens the day of surgery, during, and a little bit after?
When patients arrive at the hospital on the day of surgery, they come in with their family members, they get checked in, they change into a hospital gown. The nursing team, my team, and the anesthesiology team all see the patient, get their IVs placed, and then the patient goes back to the operating room. And in the operating room, after the patient's entered the operating room, we confirm that we've got the correct team, the correct plan, and the correct patient. And then the patients go off to sleep. The anesthesiologist is in charge of making sure the patient's safe during surgery and sleeping and having good pain control. And then I do the operation with my team. At the end of our operation, just before the patient wakes up, their breathing tube comes out, then they're awake. They move over to the recovery room. We transport them over to the recovery room. At that time, I meet with the patient's family members face to face and update them as to how their loved one's doing. The patient then spends usually about 1.5 to 2 hours in the recovery room as the anesthetic wears off, so they can start having conversations and remember what's going on and get them some food. Then family members visit the patients, and shortly after that, we get them up to their private room upstairs in the recovery ward dedicated to thoracic surgery patients. And again, patients get more food, they get up and walk, and family members can be there and stay with them in those rooms. And then myself and my team check on the patient regularly that day and each subsequent day until they go home. So during lung surgery, one of the specific considerations we need to make is how do patients breathe while we're operating on their lungs? And it's done with a very clever device that's a breathing tube that goes into both lungs. And say we're doing an operation on the right side, we breathe through the tube going into the left lung. So patients are breathing on their left lung during surgery, and we actually have the anesthesiologist suck the air out of the lung on the right side so that we can not have that lung moving while we're operating. And in addition, the patients are lying on their side during surgery on big padded beds with lots of pillows so that we can easily get into the chest on the side where the cancer is, where the operation is going to be, and not have to have that lung moving, and we can get to the front and back and sides of that lung without having to move the patient during surgery.